What is a key responsibility of a home health aide when caring for a bedridden client? A. Administering intravenous medication. B. Conducting physical therapy sessions. C. Preventing bed sores by repositioning the client regularly. D. Diagnosing medical conditions. Answer: C. Repositioning helps prevent pressure ulcers, a common issue in bedridden patients. How often should home health aides document the care provided to their clients? A. Weekly. B. Monthly. C. At the end of each shift. D. Only when requested by a nurse. Answer: C. Regular documentation ensures accurate records of care provided, which is essential for ongoing treatment and care planning. Which of the following is a correct procedure when transferring a client from a bed to a wheelchair? A. Lock the wheelchair brakes. B. Position the wheelchair at a 45-degree angle to the bed. C. Use the client's arms for support. D. Ask the client to stand up quickly. Answer: A. Locking the wheelchair brakes prevents the wheelchair from moving, ensuring a safe transfer. When should a home health aide wash their hands? A. Only when they are visibly dirty. B. Before and after each client interaction. C. Once per day. D. Only after using the restroom. Answer: B. Hand hygiene is critical in preventing the spread of infection. What is the most effective way to communicate with a client who is hearing impaired? A. Shouting to ensure they hear you. B. Writing down important information. C. Speaking very slowly and exaggerating words. D. Facing the client and speaking clearly at a normal pace. Answer: D. Facing the client allows them to read lips and see facial expressions, which aids in communication. How should a home health aide respond if a client refuses to take a bath? A. Insist on giving the bath immediately. B. Report the refusal to the nurse and document it. C. Skip bathing for the day. D. Force the client to bathe. Answer: B. Documenting the refusal and informing the supervising nurse is the appropriate response. What should a home health aide do if they notice a client's medication is missing? A. Refill the medication themselves. B. Ignore the issue unless the client complains. C. Report the missing medication to the supervising nurse immediately. D. Ask the client if they misplaced it. Answer: C. Medication issues should be reported promptly to ensure client safety. How can a home health aide help prevent dehydration in clients? A. Encourage fluid intake throughout the day. B. Limit fluids to prevent incontinence. C. Give fluids only during meals. D. Rely on the client to request drinks. Answer: A. Regular encouragement to drink fluids helps maintain hydration. What is an appropriate action if a client is found on the floor? A. Immediately lift the client back into bed. B. Assess the client for injuries and call for help. C. Leave the client and go get help. D. Wait for the client to get up on their own. Answer: B. Assessing for injuries and ensuring safety is critical before moving the client. When feeding a client with swallowing difficulties, the home health aide should A. Feed the client quickly to finish the meal. B. Offer small bites and thicken liquids. C. Tilt the client's head back to help with swallowing. D. Allow the client to eat independently. Answer: B. Small bites and thicken liquids reduce the risk of choking. What should a home health aide do if they notice a change in a client's vital signs? A. Continue monitoring to see if the change persists. B. Record the change and notify the supervising nurse immediately. C. Ignore the change if the client feels fine. D. Adjust the client's medication. Answer B. Prompt reporting of changes in vital signs is crucial for appropriate medical response. Which of the following is an important aspect of providing personal care to a client? A. Working quickly to finish tasks. B. Respecting the client's privacy and dignity. C. Making all decisions for the client. D. Performing tasks without explaining them to the client. Answer B. Maintaining privacy and dignity is essential in personal care. What is the correct response if a client expresses feelings of depression? A. Ignore the comments and change the subject. B. Listen and report the concerns to a supervisor. C. Advise the client to get over it. D. Suggest that the client is being overly dramatic. Answer B. Reporting mental health concerns ensures the client receives appropriate support. How should a home health aide handle a client's personal belongings? A. Keep them in a shared space for easy access. B. Store them out of the client's reach. C. Respect and handle them carefully. D. Discard anything that seems old or unused. Answer C. Respecting a client's belongings maintains their dignity and trust. When should a home health aide use a gait belt? A. Only when transferring a client from a wheelchair to a bed. B. Whenever assisting a client with mobility, as needed. C. Only if the client requests it. D. Never, as it is the nurse's responsibility. Answer B. A gait belt provides safety and support during transfers and ambulation. Which of the following is a symptom of hypoglycemia, low blood sugar, that a home health aide should be aware of? A. Increased thirst. B. Sweating and shaking. C. High fever. D. Unusual weight gain. Answer B. Hypoglycemia can cause symptoms like sweating, shaking, and confusion. If a client has difficulty breathing, what should the home health aide do first? A. Leave the client alone to rest. B. Call for emergency medical assistance. C. Offer the client food or drink. D. Encourage the client to walk around. Answer B. Difficulty breathing can be a sign of a serious condition requiring immediate medical attention. How should a home health aide dispose of used gloves? A. Place them in a regular trash bin. B. Throw them on the floor. C. Dispose of them in a designated biohazard container. D. Rinse them and reuse. Answer C. Used gloves should be disposed of properly to prevent the spread of infection. What is the purpose of range of motion (ROM) exercises? A. To build muscle strength. B. To increase client flexibility and prevent joint stiffness. C. To prepare the client for surgery. D. To tire the client out. Answer B. ROM exercises help maintain or improve joint flexibility and prevent stiffness. Which is an important consideration when providing care for a client with dementia? A. Maintaining a consistent daily routine. B. Avoiding any form of physical contact. C. Leaving the client alone for extended periods. D. Limiting communication to reduce confusion. Answer A. A consistent routine helps reduce confusion and anxiety in clients with dementia. What is the best way to communicate with a client who has aphasia? A. Speak louder than usual. B. Use simple, clear language and gestures. C. Avoid all communication to prevent frustration. D. Communicate only through written notes. Answer B. Aphasia affects the ability to communicate, so using simple language and gestures can help convey messages effectively. What is a sign of dehydration that a home health aide should watch for? A. Excessive sweating. B. Dry mouth and cracked lips. C. Increased urination. D. Clear, pale urine. Answer B. Dry mouth and cracked lips are common signs of dehydration. What should a home health aide do if a client expresses suicidal thoughts? A. Ignore the comments, assuming the client is not serious. B. Discuss the comments with other clients. C. Report the situation to a supervisor immediately. D. Promise to keep it a secret. Answer C. Suicidal thoughts are a serious matter and must be reported to ensure the client receives appropriate help. How should a home health aide assist a client with limited mobility in maintaining skin integrity? A. Leave the client in the same position all day. B. Frequently reposition the client and check for pressure areas. C. Apply lotions to the skin and use a blanket. D. Limit fluid intake to reduce swelling. Answer B. Repositioning helps prevent pressure ulcers, and checking for pressure areas ensures early detection of skin issues. What is the purpose of a care plan for a client? A. To provide a detailed schedule for the aide's duties. B. To outline specific tasks and care required for the client. C. To serve as a contract between the aide and the client. D. To list the medications the client needs to take. Answer B. A care plan provides detailed guidance on the individualized care a client needs. What is an appropriate action for a home health aide if they are unsure how to perform a task? A. Attempt to perform the task anyway. B. Ask the client for instructions. C. Contact a supervisor for clarification and guidance. D. Ignore the task and move on. Answer C. It's important to ensure tasks are performed correctly and safely, and supervisors can provide necessary instructions. Which of the following is a safety measure for preventing falls in a home care setting? A. Keeping floors clutter-free and dry. B. Leaving rugs in place for decoration. C. Encouraging the client to move quickly. D. Locking the client's wheelchair in one position. Answer A. Clear and dry floors help prevent slips and falls. How should a home health aide handle a client's complaints of pain? A. Dismiss the complaint as normal. B. Report the complaint to the supervising nurse. C. Give the client over-the-counter medication. D. Suggest the client rests and does not move. Answer B. Reporting pain allows for proper assessment and management by a healthcare professional. What is the appropriate response if a client requests help with an activity not included in the care plan? A. Refuse and strictly adhere to the care plan. B. Provide assistance if it seems harmless. C. Politely decline and report the request to a supervisor. D. Allow the client to do it themselves. Answer C. Ensuring that activities are within the scope of practice and the care plan is crucial for client safety. Which of the following practices helps maintain client confidentiality? A. Discussing client cases with friends. B. Sharing client information only with authorized personnel. C. Leaving client records open in public areas. D. Posting about work experiences on social media. Answer B. Confidentiality is key in healthcare, and sharing information only with those involved in care is necessary.